tell you a little bit about the new COVID-19 Pfizer press release announcement that was just made just a couple of days ago. So with the Pfizer press release, which does not include any data, but what it is telling us is that the vaccine is about 90% efficacious. And so this is great news because the federal, the FDA has put the bar at about 50% effectiveness, and so this is above the 50%. But there are some caveats, and so there's a lot of things we still don't know. We have more questions than answers at this moment. So while this is great news for public health and really for the world, we still need to know, is this vaccine going to help prevent severe disease and hospitalizations? How long the immunity can last for, and how protective it is. These are the type of questions that we will find out in long-term studies. In terms of when we can expect to have this vaccine to the general population. As you know, here in the United States, it's going to be prioritized first to the healthcare workers and those that are highest risk for severe illness. And then it'll go into the general population. So when this will happen is sometime next year in Q2 or Q3 of 2021. By that time, we may have multiple different COVID-19 vaccine available in the market. And so this is something that everybody is keenly aware of and following up and monitoring. For the Pfizer vaccine, they are stating that as you know, these are event-driven events, and so sometime in late November, they may file an application with the FDA for approval of an emergency authorization use. And so by that time, it'll take a couple of weeks to actually review the application and then actually have the vaccine available for wide use and distribution for the first priority group. So, as you also may know, we are seeing explosive growth of COVID-19 all around the world, over 50 million cases, over 1 million deaths being reported. This number is only going to continue to rise. And so it's really important to understand that while we are following the results of the vaccine and when it's going to be made available, it's not available right now. And so what we need to continue to do is what we're doing every day. We need to continue to wear a mask. We need to continue to socially distance. And we want to continue to make sure that we're limiting any contact with non-household members, keeping these gatherings outdoors if we can, limit crowds, limit extended duration of exposure to any non-household members. These are what we call non-pharmaceutical interventions, and these are very simple measures. As simple as they may be, they have very effective results on reducing the spread of COVID-19, and that is what's very important right now.